This is Financial Standard, the definitive source of news, thought leadership and analysis for Australian wealth management professionals. Financial Standard. Take the lead.
Welcome back to the podcast. I'm with David Burrows, Westpac's Chief Mental Health Officer and Principal Psychologist. David, welcome to the podcast.
Yeah, thank you very much for having me. I'm really looking forward to the podcast today.
Fantastic. Look, we wanted to kind of discuss, dive into the mental health in, the financial services sector. And just to kick things off, what are some of the unique mental health challenges faced by professionals in this area?
Yeah, look, it's interesting. I'm not sure if the challenges are unique to any particular sector. By virtue of being human, we can all be vulnerable at different points in time. And, like any organisation, any sort of sector, we can expect to see people with a range of mental health related concerns. Anxiety is going to be quite common. Depression is going to be quite common. We see in high tempo work environments, which is what the financial services sector is like. Things like burnout and fatigue can be quite significant things that impact people as well. But there's also situational stressors, just, when life gets in the way and people having challenges and things outside of work that they're not unique to any particular sector. But the financial services sector is one that's, it's quite regulated. It does work at quite a high tempo. It does attract certain sorts of people. So, we have to expect a level of vulnerability there at times for sure.
Definitely. And based on your experience, though, how prevalent are, stress, anxiety and depression, in workplaces more broadly than just the financial services sector? And, how significant of an impact do you think this has on employee productivity and well-being?
Yeah, it's a really good question. And I think stress is an interesting one in that there's stress within every workplace, within every industry, within every sector. Like, it's just one of those things that are there. When stress is problematic, that's when we need to be concerned. But things like anxiety and depression are relatively common. We know that 1 in 5 adult Australians will experience a diagnosable mental illness at any time in a 12-month period. We know that nearly 50% of us will experience a diagnosable condition at some point across our lifespan. And anxiety and depression are the two main ones we're most likely to see there. Anxiety, the most prevalent one we're likely to see. Impact it has, can be quite significant. It's hard to be working your best if you're not feeling your best. If you're experiencing, significant challenges around mental ill health, it is going to have an impact on you, both inside and outside of work. I think what we need to be cognizant of, though, is that how good work is good for people, also how that mental ill health does not discriminate. And it's unrealistic to think that we won't have people who aren't impacted by things like depression, anxiety, and other mental health concerns at any particular point in time. I don't actually have any high-level data on the financial sector itself, but we know that things like anxiety and depression in particular are really quite prevalent at a societal level, and all workplaces, all industries are just a microcosm of society.
That's a really interesting point. So in that case, what do you think some of these biggest challenges that employees are facing when dealing with mental health issues at work? And likewise, what are some of the bigger problems for employers?
Yeah, okay. Some of the biggest challenges I think employees face is there's still a lot of stigma associated with mental illness. I think that's one thing there. I think there's still a lot of stigma associated with different levels of vulnerability. So, it's not just mental ill health that causes people challenges at work. It can be financial distress, relationship issues, all sorts of other issues as well. But a big challenge for a lot of employees in particular is there's still a lot of understanding across some workplaces around how work itself influences mental health and wellbeing outcomes. So what that means is there's often an over-reliance within organisations of generic support systems or just asking people to be more resilient rather than really looking upstream at how the way we're working, how we're designing work, how workplace factors may be having an impact or an influence on people's mental health. So I think there's a big challenge there around, are employees getting the right sort of support that they need, but are organisations actually working in ways which they're identifying and addressing those organisational barriers to wellbeing so that our focus is not on fix the person, but our focus on how do we be able to support people really well, but understand the influence of work when it comes to things like mental ill health and people's stress levels and burnout, which are significant concerns for us all.
And what do you think employers should do?
Well, I think we've known for quite some time what employers should be doing in this space, and that is really changing their focus and looking much more upstream around, is work protective for people or is work harmful for people? I think employers really need to focus on this notion of, are we improving people's experience of work, rather than just asking people to be more resilient or just to take on more, or to perhaps just have a growth mindset, be more optimistic around things. So, I mean, it's good news there that we've got a changing regulatory environment when it comes to workplace health and safety that's supporting that. But the more that we have employers really understanding that mental health is a positive concept, that mental ill health doesn't discriminate, that none of us get immunity from mental health-related concerns, that vulnerability is real, that you can experience vulnerability. That doesn't mean you're not going to be a great contributor and performer. But really importantly there, the extent that we have organisations looking at mental health through the lens of, are we designing work in ways in which it's good for people? Are people having a positive experience of work? Looking at, do we have the right support systems in place? Now, they're the sorts of things that we really need to be paying attention to if we're going to move the needle in this space. A lot of the stuff that we see happening in this area might look good, might be really well intended, but there's increasing understanding that the focus on mental health in the workplace has not necessarily been in the right area in the last sort of 15 to 20 years, which is why we're not necessarily seeing workplace mental health improvements the way in which we ideally would have liked.
When we discuss the stigmas surrounding mental health in the workplace, do you think that is there any sort of unique factors to financial services in terms of how it might affect employees or employees or employers, or is it more of is this just a general across the board problem?
I think it is a general across the board problem, but the financial services industry is one that attracts people who are attracted to high tempo working environments. It's an environment where there's high levels of workplace change. There's often higher levels of expectation that people have on themselves or expectations on others. So it can be, as an industry, it can be a stressful sort of place to be. And we do need to recognise that it is different to other organisations. But I think the notion of stigma is common across most workplaces. There can be differences in male-oriented industries compared to other industries. There can be differences where we've got different age demographics and those sorts of things. But stigma is a universal problem that we face. And that one of the biggest issues I think we have with that stigma is the lack of understanding across communities around what we mean by mental health. If you were to ask 1,000 people what's the first word to come to mind when you say the word mental health, they're likely to say things like depression and anxiety. If you ask 1,000 people what's the first word to come to mind when you say physical health, then they're typically going to think of sleep, exercise, nutrition, and those sorts of things. It's a big issue for us because people intuitively understand that nobody chooses to have poor physical health. Poor physical health doesn't discriminate, and that physical health is something aspirational, a positive concept. And yet the narrative that we have around mental health is through a deficit-based lens. Now, what this means is rather than most people recognising that mental ill health doesn't discriminate, that nobody chooses to have mental health-related concerns, that having experiences in mental health doesn't mean you're not going to recover or you can't be a great contributor or performer. It means that a lot of people focus on mental health through what is wrong with people and through a deficit-based approach. So that's something we've got to be quite conscious of. The World Health Organisation has defined mental health as a positive concept for very many years. Australia's own National Communications Charter for Mental Health and Suicide defines mental health as a positive concept and recognises that mental ill health doesn't discriminate. So I think the stigma piece is a big one there. But I think the more that we can understand the reality of what mental health is, we can look to things like Australia's National Communications Charter for Mental Health and Suicide. We can stop our reliance on things like just big landmark awareness days and those sorts of things and really look and understand how, beating stigma is a really important part of it. It's only one piece of the puzzle when we really want organisations and industries to focus and get better at what they're doing around workplace mental health, the prevention of harm, early intervention, and providing the right types of support for people.
Not to play devil's advocate, but are there any risks to encouraging more open discussions about mental health at work?
Look, there can be risks, and the risk is typically, is my organisation ready for this? Do they actually have an approach that recognises the notion of good work is good for people and mental health doesn't discriminate? Is my organisation sort of equipping leaders to understand that vulnerability is a normal part of life and to be expected, and that mental health related concerns are going to happen at times? Do my leaders have the maturity to be able to engage in those conversations, and are there the right escalation pathways and support mechanisms in place for me? So, in short, there can be a risk around these sorts of things if the organisation is not ready for it. I think, though, that most organisations are working very hard to do the right thing for their people, and most of them are actively engaging now on much more sophisticated approaches to the way they look at workplace mental health. And pleasingly, we're seeing a move away from a lot of the sort of really popular, high visibility, low impact, community based programs around just simple mental illness literacy or resilience and those sorts of things that just haven't been working well for organisations or for people themselves. So I think there's definitely a shift we're seeing in that space, but you're absolutely right. Vulnerability comes with risk. We hope that people have got the right level of psychological safety within their organisation to put their hand up and be vulnerable. It's a universal phenomenon. We also really need to ensure that our organisations are designed and equipped and resourced and have the right systems and mechanisms to be able to support that vulnerability when people are brave enough to bring that up and raise it with us.
Do you think smaller firms might have a challenge perhaps greater than larger firms in some respects with regards to not feeling like they have the resources to tackle this problem internally?
Yeah, I think that does happen. But also, I do believe that I work with outside of Westpac. I work with a lot of very big organisations, and not just within Westpac. And I think a lot of larger organisations are grappling with this as well, as how do we move towards appropriate supports and evidence-based practice rather than what we've been doing for all these preceding years. But it is more difficult when you don't have dedicated HR departments or work health and safety professionals who are trained in psychological health and safety and those sorts of things. But pleasingly, for smaller businesses and smaller organisations, I'm seeing a proliferation of a lot more really robust support systems and tools and sort of government departments stepping up to make it easier for them to manage the mental health and wellbeing of their staff and to look at how are they minimising that risk of psychological harm. And a big call out here to SafeWork New South Wales, who does an amazing job looking at the things they provide for small business mental health around, evidence-informed training from the Black Dog Institute. It's not just your generic mental illness awareness. And, appropriate support mechanisms for small business to help them understand what they need to do to support the mental health and wellbeing of their staff. We're seeing some of the charitable organisations come up with sort of mechanisms now that, everyone can tap into that don't cost any money, is that where you can get sort of low-level coaching and support when people are vulnerable. So I think there's definitely things happening in that space. It is certainly harder for smaller businesses. I think one of the biggest challenges there is knowing where to go to get that information, knowing where to go to get that support. I mean, I do a lot of work in the small business space, and I love the work of Everymind. I love the work of aheadforbusiness.org.au. I think some of the stuff they do in the small business space is absolutely fantastic. But I think it is important to recognise that not every organisation out there has got those internal capabilities, the systems and structures in order to support mental health the way which we really would ideally like them to do.
Another point which I think is quite interesting is to what extent employers should be responsible for the mental health of their employees. where is the line kind of drawn between personal and professional responsibility in terms of, addressing mental health concerns?
Yeah, that's a really good question as well, and it's one that comes up quite a lot. I think it's good to step back to that problem and recognise that none of us get immunity from mental health-related challenges, that we're going to have people within our workplaces experiencing mental health-related concerns, and that's got to be expected. I think what we're seeing, though, is across most of Australia, we now have psychological health and safety regulations. And in the absence of those regulations, we've still got health and safety responsibilities now where every organisation needs to identify parts of work that can be hazardous for people's mental health and wellbeing, to assess the risks associated with those hazards, to put effective controls in place, monitor those controls and do it through a lens of consultation. So that is a big movement we've had in the workplace health and safety space. And that's a real recognition of the impact work has on people's mental health and wellbeing. And it does place a formal responsibility on organisations to make sure that they're not just focusing on the support for people, but they're really looking at things from a preventative lens. So I think it's actually a really good thing that that's actually happening. The other way that I like to look at this too is, an organisation does not actually have responsibility for somebody's, what's going on in their personal lives. That doesn't mean that they can't provide the right support and things in place for them to actually connect them to the right sort of, resources and things to help manage challenges that they might be experiencing outside of work. And I think that's an important thing as well. But I mean, a really big part of it for me, and from a philosophical and a practical perspective, is, if we can't control somebody's individual wellbeing or vulnerability outside of work, we don't necessarily have the ability to do that. But it is to ask the question whether is somebody's experience of work adding to their stress and contributing to the likelihood of mental health-related vulnerability, or is work protective for their mental health and wellbeing? And that's the big challenge that I have, with lots of the organisations I support and the advocacy work that I do, is really how are we designing work in ways to remove those barriers to wellbeing? How can we ensure that work is protective for people's mental health and wellbeing? So irrespective of whether the person's experiencing vulnerability from outside of work or within work, we're doing all that we can to ensure that we're addressing those organisational barriers and making work as good a place as what it can possibly be. I mean, you think about how much time you spend at work, it is a lot. Yes, we do have a regulatory responsibility now, we always actually have, to ensure that work is psychologically healthy for people. But I think organisations are realising very much so that they've got a moral responsibility here as well, and that if we're designing work in ways that are good for people's mental health and wellbeing, it's not just going to give you a positive mental health impact. It's good for performance, productivity, retention, and those sorts of things as well. So the line between the personal and professional is always going to be a tricky one. Where do we have the most influence? It's the way in which we design work and how we remove those organisational barriers. And I think the big focus here should be whether is work protective to people or is it harmful? What is their experience of work like? Recognising that none of us get immunity from mental health-related concerns or the ups and downs of life.
Thank you, David. Plenty to take away from that, but thank you very much for your time.
My pleasure. I hope you got something useful out of that.
Thanks for listening to this Financial Standard podcast. For more information, visit financialstandard.com.au. Please keep in mind that the information discussed in this podcast is general in nature and does not consider personal circumstances. Reliance should not be placed on any content without further independent financial research and advice.